Welcome to Shape of the City. I'm Clover Frederick and I'll be your host. Unintentional injury is the leading cause of death in children and teens in the U.S. An organization called SafeKids is hoping that with knowledge comes the power to reduce preventable deaths in kids. With me today are Brian Baker from SafeKids Lincoln-Lancaster County and Melissa Kinzie from Lincoln YMCA SafeKids Water Safety Task Force. Thank you both for joining me today.
Glad to be here.
All right, now let's start with Brian. Brian, what are some of the leading causes of unintentional injuries in kids?
Well, by far what we see the most of are falls. These could be falls from the same level, such as slipping, tripping, stumbling, that kind of thing, or falls from different levels, from level to level, such as falling off of a crib or chair, bunk bed, those types of things. But falls are by far what we see the most of as far as what we see treated in hospital emergency rooms.
Okay, now tell us more about SafeKids. What are the goals there and how to get started?
We have a very simple goal with SafeKids, and that's to prevent the #1 killer and disabler of children, which are unintentional injuries. SafeKids, locally here, we're part of an umbrella organization called SafeKids Worldwide. It was started in the mid-'80s by a physician in Philadelphia at the Children's Hospital there, and he just became weary of treating so many kids that he knew didn't have to be there in the emergency room receiving his care if something could have been done to prevent it, which he knew there were things to prevent these injuries from happening so that, again, he wouldn't have to spend the time and energy and money that it costs to treat these kids for those injuries.
Now tell me what SafeKids is doing right here in our community.
SafeKids Lincoln-Lancaster County works to address the leading local causes of unintentional injury to kids by looking at the impact that these injuries are having. So we receive hospital data that tells us what injuries are occurring, to what extent they're occurring, and what impact they're having in our community. So what we've done is we've structured ourselves into task forces that look at the leading causes of injury, and we mobilize the community and focus on how we can reasonably address each of these injury areas.
Okay, so what are some of those task forces, those injury areas here locally?
We have a water safety task force, we have a sports injury prevention task force, we have home safety task force, we have a child bike and pedestrian safety task force, we have a child passenger safety task force. So those are the injury areas that we look at here because those are typically the leading causes of injury in our community.
Okay, now this is a task that can't be done alone, so I'm sure you have partners in the community. Who are some of your partners?
We have over 50 partners that help us out at some level. Some of them open up their car dealerships to allow us to do child passenger safety seat checks. Some of them, like the YMCA here, allows Melissa to come in and actually chair the Water Safety Task Force, spend her time, some of the YMCA's resources to enable us to effectively address water safety. So we're so thankful for all of the commitment and support we receive from many organizations in Lancaster County to make SafeKids what it is today. And that's an effective tool that the community can use to address childhood injuries.
Great. Now that's a great segue into talking to Melissa about water safety, especially now that summer's coming up. Tell us what the SafeKids Water Safety Task Force does to prepare parents and children.
The Water Safety Task Force does a variety of things to prepare water for the summer in the water. We work with boat safety. The Game and Parks Commission, as well as the U.S. Coast Guard Auxiliary, does boat safety, and they're out every weekend out at our local lakes like Branched Oak and reminding boaters to use their life jackets and having Coast Guard approved life jackets and reminding kiddos to have those on because under the age of 13 they do have to have a life jacket. It is state law. In the city, we have a wide variety of organizations, including the Y and the Parks and Rec, and we work with pool safety, and we are working with the daycares and their providers and their staff on how to go to pools safely and keep those kiddos safe. And then we also work with the health department, and we're working on fence safety, home pool safety, because you don't have a lifeguard when you're at home, but how to do those things, have a pool safe at home. And we talk about drains, entrapment, fences, and a wide variety of things like that.
Okay, very good. Now, what's probably the biggest message you want the public to know about water safety?
The biggest message is supervision. Supervision, supervision, supervision. You cannot supervise enough. You need to put your phones away. It's very easy to have your iPad, whether you're at the bathtub or you're laying out and your kids are splashing around in their little pool on your driveway. You have to be watching. It takes seconds for kids to drown or near drown. It only takes 18 inches of water for a child to drown. And so supervision, supervision, supervision.
So how prevalent is drowning here, and what can parents do to prevent it?
Luckily, we are not Arizona and Florida, so it is not as prevalent as it is in those areas, but it's not something to turn a blind eye on. It is something that can happen in a second. Nationally, there are 3 deaths a day on average of kids that drown. And so we want to make sure that we are not on that map. We want to make sure that we have kiddos in swimming lessons to learn the rules, the policies, procedures, and just learning how to swim and feeling safe in the water and having a healthy fear of the water of where they can and cannot be. And it's good for the parents to know what their kiddos' swimming ability is so that they know when they go swimming together that they can do it in a fun way. But also just making sure that they know the rules and the water depths. If you are taking your kiddos to a pool that has lifeguards, obviously those lifeguards are watching everybody's kids. And so you still need to be able to watch your own kids, know where they can and cannot touch. Make sure that you walk around the pool and make sure that they know where those hazards may be. When you're out at a lake and you can't see the bottom, walk the water first. Don't just put your kids in a life jacket and throw them and say, go have a good time. Make sure that you know what hazards there might be, where the drop-offs might be, and how far the beaches may be so that you know where they will stop and go. Because you turn around for a second and they could be under the water.
Okay, very good. Now, Brian, besides water safety, what are some of the other safety issues that SafeKids is talking about this summer?
Well, one thing that we want to stress is for parents or anybody transporting kids never to leave a child in the car, especially now that we're getting to the summer months. The last 5 years, we've had an average of 40 kids die as a result of being left in cars. And so we don't want that happening on our watch in Lincoln-Lancaster County, Nebraska. So there are things you can do, such as putting your purse, your briefcase, your cell phone in the back seat with your child so that you don't forget them. Some people have even gone to taking off their left shoe and putting it in the back seat because you're not going to go anywhere without both shoes on. So that's one thing. And then the other thing would be to remind parents to always have their kids wear a bike helmet. So many serious injuries could be avoided, especially throughout the summer months with kids, if they just wear their bike helmet and wear it properly. So those are the 2 things that I would stress.
Okay, very good. Now, if there are people in the community that want to become involved or they would make a great partner, how can they learn more?
They can certainly call me at the Health Department at 441-8046 or go to our website, SafeKids Lincoln. Learn more about us and be involved as much as you can. We'd love it. Any support we can get, we'll take it.
All right, great. Thank you both for being here and for all the hard work you do to keep kids safe.
Thank you.
When we return, we're going to talk with an agency who's been in Lincoln for 40 years helping victims become survivors of abuse.
It's one of the coolest things about kids, the unknown, the potential, the chance to do or become whatever they can imagine. But what if something happens during childhood that stops them from reaching that potential? Did you know that preventable injuries are the #1 killer of children in the United States? And around the world, 1 child dies from a preventable injury every 30 seconds. But the important thing to remember about preventable injuries is that they're preventable. We can do something to stop them. Things to make sure kids get the chance to be creative and play. The chance to take chances and explore. The chance to fall down and get back up. Help us give your kid, and every kid, the chance to grow up, reach their potential, and become whatever they can imagine. Learn how at safekids.org.
Welcome to Shape of the City. National statistics indicate that 1 in 6 women will be sexually assaulted in their lifetime. and 1 in 4 women will be a victim of domestic violence in their lifetime. Today, we'll talk to representatives from Voices of Hope about what's being done in our community to help these victims. With me are Marcee Metzger, Executive Director, and Morgan Beal, Prevention Specialist. Let's start with Marcee. Hi, how are you?
I'm great. Nice to see you, Clover.
Nice to see you. Now, I understand that Voices of Hope started 40 years ago by some concerned citizens. Tell me why they came together and what services they originally provided.
Well, they came together because there were sexual assaults on the university campus, and it was individual women who wanted to support each other and develop allies to be able to talk to their parents and the police and the administration. It evolved into a crisis line, 24-hour crisis line that was housed at the Women's Center. And because there were so many things happening in the community that were related to rape, they decided to go off the campus and have it at Family Services. So then it was at Family Services for a number of years before it became an independent agency and merged both sexual assault and domestic violence programs.
Okay, very good. Now, besides the crisis line, what other services does Voices of Hope provide today?
We have a continuum of services. We do 24-hour advocacy to the hospitals. We respond 24 hours a day to all the law enforcement. So whether it's police department, state patrol, UNL police, the county sheriff's department, whenever there's an arrest for a violation of protection order or for a domestic assault, our advocates are called and they're able to then make contact before the person is out of jail. We have drop-in services to be able to do safety planning, help people with protection orders, be able to figure out how to talk to other people about what's happening in their lives. We have some short-term counseling. We have many different types of groups. And we also have a prevention and training program.
Okay, now tell me how prevalent domestic violence and sexual assault is in our community today.
Well, I can talk about Voices of Hope. Saw more than 2,000 individuals last year. Adult victims face-to-face, that's their primary issue, was one of these things: domestic violence, sexual assault, could be stalking in a relationship, might have been human trafficking, few gang-related violence. But those 2,000 adults and about 300 children. Of the adults, we saw about 7% that were men. The majority of those who we see are women. We saw some in the adult category that we counted as adults as over 16.
Okay. Now, who are some of your community partners that help you get this work done in our community?
Lincoln is really lucky to have a community that works so well together. We have a battered women's shelter, Friendship Home that we work closely with, Family Violence Council, coordinates with a lot of different programs. We're a part of a community coordinated response that meets regularly with the prosecutors, all law enforcement, the hospitals. We have specific sexual assault response teams that include the hospitals and all law enforcement, our advocates. We work very closely with all of the culture centers here. We work closely with those that are working with substance use and chronic persistent mental health, like Centerpoint and St. Monica's. This last year we had 204 memorandums of understanding with departments or programs in Lincoln that spelled out how we would respond and what we would do and what we would maintain in terms of privacy, confidentiality, that our services were free, and then helping all of those organizations that we were working with be able to make a safer referral, know how to respond respectfully, effectively, and understand the dynamics of tactics of control and power and control that are kind of at the root of a lot of the things we respond to.
Now, what can somebody do if they find themselves in a violent relationship?
Well, first off, I really do encourage people to call our crisis line. They don't have to tell anybody who they are. They can walk in. Our services are free, so they don't have to make an appointment to be able to walk in during our open hours. It lists all of our services on our website. I think it's really a helpful thing if somebody is able to go to the website, because we have some discussion about safety planning, what services people have available here, what is shelter, not just our program, but other programs in other communities. But if somebody's in their home and they're experiencing domestic violence, being able to tell somebody is a big deal. I think that having it be so secretive, individuals who use such tactics of control, the person who's experiencing it knows and should be able to trust their instincts about what's safe, know that there are services and people who will maintain very rigidly the confidentiality if they share their stories in our agency and with Friendship Home.
Very good. Now let's switch gears and talk to Morgan. Tell me about your role as prevention specialist.
Sure. Well, Marcee just listed a lot of the important and necessary intervention services that we provide in the community, but my role as the prevention specialist is to really work on how do we prevent relationship and sexual violence from occurring in the first place. So I work very frequently with students at the middle school, the high school level, and even college-age students about topics relating to healthy relationships, healthy and respectful conflict resolution. At UNL, I work a lot around what does consent look like, what is bystander intervention, how do we intervene in these situations where maybe we're not the perpetrator or the victim, but we're uncomfortable with something happening. And it's about providing consistent programming and ongoing dialogue with youth, with schools, and with youth agencies like Lighthouse and Cedars, the detention center. And I think the key to prevention is this ongoing dialogue of preventing these things from happening.
Mm-hmm. Now, I've been hearing the phrase rape culture a lot lately. What does this mean and what can be done about it?
Yeah, rape culture is a concept that's used to describe a culture in which rape and sexual violence is common. And we have these attitudes and these norms that tolerate sexual violence, that condone it, and I would say to a certain extent celebrate it. And so we've been hearing kind of national conversations about what rape culture is and what can we do to combat it. One example that I think of when I hear the word rape culture is the victim blaming that we have and how pervasive that is in our society. So it's, this mentality of asking the victim, well, what were you doing, or what were you wearing, or why were you at that party? And what happens is that shifts the spotlight from the perpetrator to the victim. And we know that it's never the victim's fault with these crimes, but we need that accountability from the perpetrator that's often missing. Another example of rape culture is that only 3% of rapists will ever spend a single day in jail. So if we're going to combat rape culture, it has to be done on an interpersonal kind of micro level when responding to victims and survivors, but there has to be institutional changes that happen as well. And we have to acknowledge its presence too. I think a lot of people out there say it doesn't exist, or they downplay the extent to which rape culture happens in our society. In fact, last year in the spring, there was this national conversation and people were kind of denying that it was happening, and the hashtag rape culture is win was trending on Twitter, and people were sharing everyday examples of rape culture that they saw within their personal lives, a lot of them related to victim blaming. So if we're going to combat it, we have to acknowledge it, and then we have to actively work against it. We have to talk about the victim blaming and the misconceptions head on so we can have more accurate conversations about sexual and relationship violence.
Very good. Now tell me about the hashtag I Am a Voice campaign.
Yes, so we officially launched the I Am a Voice campaign on April 23rd in recognition of our 40th anniversary. So Verizon Wireless generously donated funds to be able to have this prevention campaign widespread throughout the community and to publicize services. And so we officially kicked this off, and we're encouraging people to share their voices on social media, how they will use their voice in combating violence in our community and being that active bystander. So I brought some examples of the speech bubbles that we've been seeing popping up on social media. This is I Am a Voice that educates others, which we've been seeing a lot of students kind of sharing. Also, I Am a Voice that doesn't blame the victim. And it's been really inspiring to see all of these pictures and videos pop up on Twitter and Facebook and Instagram, and see how people are using their voice to end violence.
Great. Now how can somebody who's watching participate?
Yes, we hope that everyone will participate in this campaign and it'll spread like wildfire. If you go to our website, which is voicesofhopelincoln.org, and you click on the tab Get Involved, you can actually download this speech bubble, print it out, share how you'll use your voice, and then upload that image or that video to social media with the hashtag I Am a Voice. And you can see what others are doing as well.
Very good. All right, thank you both for being here, and it's a wonderful anniversary to be celebrating in our community. Thank you.
Thank you.
Thank you.
When we return, we'll learn about how to stay safe in the sun.
My name is Brian Ortner. I work with the American Cancer Society here in Nebraska, your American Cancer Society. Here to share a little bit today about skin cancer prevention, skin cancer awareness, and what you can do to help yourself avoid that diagnosis, especially with the summer months coming up. As an overview, skin cancer is one of the most commonly diagnosed cancers. About 3.5 million diagnoses occur each year in about 2.2 million people as a rough estimate, and that's because some people come in and present more than one area of melanoma if they are being diagnosed with skin cancer. Nearly all skin cancers can be prevented by taking a few extra steps as part of your daily routine, whether you're driving to work, whether you're outside watching a baseball game, or even as the summer ends, getting closer to watching football games when they start. You get that one sunburn, that exposure can be hazardous to your skin. It could lead to that potential diagnosis of cancer. Remember 3 little words: slip, slap, slop. It'd be fun for your kids. Say it to them when you put sunscreen on. It makes a difference in protecting their skin. The American Cancer Society recommends limiting your sun exposure over the midday, applying UV protectant sunscreen at least every 2 hours. You can wear a wide brim hat, or for your eyes, make sure you're wearing sunglasses to prevent UV damage to your eyes as well. And moms and dads, swimming is going to be a popular thing for your kids this summer. One thing to remember, even if the sunscreen says water resistant, remember to apply every 2 hours to make sure that your kid's skin is protected while they're out enjoying their day. We just celebrated Memorial Day weekend. The Friday before Memorial Day every year is called Don't Fry Day, and that applies for more than just the Memorial Day weekend. It applies all summer long. Be smart, be responsible, take the steps to protect yourself this summer while you have fun outside. For more information, visit cancer.org and search for the area called Be Safe in the Sun. Or if you have questions, you can call 1-800-227-2345 24 hours a day, 7 days a week to answer any questions you might have.
Shape of the City is dedicated to helping Lincoln stay informed of health and wellness topics and events. Visit our calendar at lincoln.ne.gov, keyword 10health. If you'd like to see your event covered, email us at 10healthlincoln@gmail.com. Thank you for watching. Until next time, get active, eat healthy, and stay informed.